Odyssey diode lasers can be extremely effective tools in the management of periodontal disease. Coupled with the laser's ability to reduce bacteria and effectively remove pocket-lining epithelium and granulation tissue, the Odyssey diode lasers can serve as an effective modality in the adjunctive treatment of periodontal disease. The purpose of this procedure is to remove diseased or inflamed soft tissue in the periodontal pocket and to improve the clinical indices, including gingival bleeding, probing depths, attachment loss, and tooth mobility. The laser procedure is intended to be an adjunctive treatment to conventional scaling and root planing, not a replacement or substitution. Set the Odyssey diode laser power to 0.8 watts in continuous mode. Then initiate the fiber tip. Gently probe the pocket to get a sense of its geometry. After conventional instrumentation has been completed, calibrate the fiber tip to the pocket depth. Begin to lase the diseased epithelial lining. Always use the lowest amount of power necessary to reach the treatment objectives. Keep the fiber parallel to the root surface during lasing, or with the tip slightly tilted toward the gingival tissue in order to maximize ablation of the inflamed tissue. Keep the fiber tip in contact with the epithelium. Move the fiber in both horizontal and vertical directions, covering the epithelium and adjacent inflammatory connective tissue. Move the fiber smoothly and at a moderate speed. Debride all granulation tissue. You may use a fine water spray during laser treatment for rinsing. Remove plume and debris with the high-volume evacuation, which will also tend to cool the tissues and reduce the need for anesthesia. The total amount of time for this laser procedure is a function of the extent of the diseased soft tissue. In general, lase pockets 6 millimeters or less for approximately 30 seconds buccal and 30 seconds lingual, and lase pockets greater than 6 millimeters for 45 seconds. Another indication of the complete removal of granulation tissue is the beginning of oxygen-rich or red bleeding from the treated site. If the patient experiences noticeable discomfort, lower the power setting. Anesthetic may be administered.